The pandemic lockdowns have been hard on people's mental health.
Medical reporter Liz Bonas shares what's behind new concerns, especially in young people.
Hey there, everybody. Hello to you. Pediatric mental health visits to physicians spiked in this pandemic. This according to a study just released in JAMA Pediatrics. Early on in July of 2020, rates of visits to mental health services were 6 to 15% above previous years. The biggest increase seen in adolescent girls. For mood and anxiety disorders, visit rates were also as much as 10% higher than in previous years.
The past few years with COVID and schools being virtual, it's been really hard to be able to talk to each other.
Alicia Stevenson, Ariel, and Elijah say they want other teens to know
it is completely okay to talk about your feelings, and I think that's a problem with society now.
All this in the aftermath of this working paper released on lockdowns by the Institute for Applied Ergonomics, Global Health, and the Study of Business Enterprise at Johns Hopkins. The key conclusion, lockdowns only reduced COVID-19 mortality by 0.2% on average. While there were certainly critical health benefits,
what the lockdowns did do is they spread it out so that all the patients weren't in the hospital at the same time.
This Teen Talk team acknowledging they are feeling the risks.
Our kids are just suffering. They're sad, they're depressed, they're suicidal.
So as for what many are concluding now,
would we have locked down to the extent that we did? Probably not. And I think that in future outbreaks and or pandemics that we will be more thoughtful in what we and how we restrict individuals, especially schools.
I certainly think it's very reasonable at this stage of where we're at to start opening things up, relax some of the social mitigation policies that we've instituted. And depending on the population, I think masking can go away as well.
Best thing to do if you're still struggling with the fallout, tell your primary care doctor. I'm medical reporter Liz Bonas. Now back to you.
From